Welcome back to the Brain Injury Discussion. This is Jay with your next episode, Mechanism of Brain Injury. I'll be pulling from sources, and of course you can find the details in the description below, but we're pulling from the Essential Brain Injury Guide, as well as Evaluation of Determinate Disability Determination Process for Traumatic Brain Injury in Veterans from the National Academies Press, definitions of traumatic brain injury, as well as Understanding Acquired Brain Injury, a review of biomedicines. Those are the sources. Feel free to comment, like, subscribe, but let's get into it. So what is an acquired brain injury? That's what we're talking about. And acquired brain injury covers a lot of area. And what we're looking at is some sort of insult or damage or injury to the brain that is not congenital or not born with, and not degenerative, which is losing it over time. An example of congenital would be a birth defect. An example of degenerative would be, obviously some sort of an injury, not really an injury, but, degradation of the brain. So we're not looking at that per se, but those could be, the after effects of a brain injury could lead into a degenerative disease process. But anyways, let's get into it. Acquired brain injury. We have to first subdivide it into the traumatic camp and the non-traumatic camp. So let's look at that non-traumatic camp real quick. Non-traumatic injuries imply just that. There's no traumatic impact to the brain. So you can get an injury to the brain through a number of different sources. And some of them are not going to be traumatic, injuries to the brain. So let's think along the lines of stroke, maybe a brain tumor. What about encephalitis or the inflammation of the brain against the hard skull, which again, this is a very um, soft jello-like organ inside of a very hard skull, and that is a confined space. So when there's inflammation, there's going to be pushing against the sharp bony ridges as well as the surface of the skull. We don't want that, but that's something to think about. Oxygen. Oxygen deprivation, such as anoxia, loss of oxygen, or hypoxia, or not enough oxygen, those can cause brain injuries, as well as circulatory anoxia, which is usually found during heart attacks or whenever you have those kind of a cardiopulmonary arrest event. So what we're looking for is, hey, when you're doing that CPR, which again, I recommend people go out and get certified and trained in CPR. When you're doing that, you're actually sending fresh blood, like you're sending oxygen, you're trying to send that oxygenated blood to the brain to keep the brain alive. And the same thing goes with the heart. You're trying to circulate the blood. That way you can save the individual. But even after that, there might be some residual brain damage depending on how much oxygenation you get to the blood, get to the brain. As well as you also have medication overdoses, as well as other medications might affect the brain and might cause damage. So think about it. There's a lot out there. There's a lot of different causes. There's a lot of different mechanism of injury. Now, if you're a nurse or if you're in that medical field, EMS, that is a very common phrase to use, the mechanism of injury. And that's what we're focusing on today. Traumatic brain injury. So let's go back to our brain here. Now, again, this is what everyone thinks a brain looks like, but it's actually not just the outer sulci and gyri, but it's also the inner structures as well. And we'll do that in a later video talking about the deeper anatomy inside the brain. But what we're talking about is a direct force onto the brain, some sort of a traumatic event. And this can happen a very different, very numerous ways. So some examples, and this gets divided even further into penetrating, non-penetrating. So traumatic events happen inside the skull, or maybe it goes through the skull. And so you get some penetrating examples like a gunshot wound, a falling object on a construction site that pierces the skull. Again, looking back to our previous episode, told helmets are a great thing. It helps prevent those kind of injuries, but they can still happen. So you have those things as well as surgery that goes and has to go through the skull, has to go through the cranium, go through the meninges to maybe remove that tumor. That could be considered a traumatic brain injury, a penetrating one at that. But what we mostly think about traumatic brain injuries are those non-penetrating injuries. And so we're going to, think about concussions. We're going to think about blunt force trauma, maybe a blast wave if you're in a military environment, falling, falling down, head hits something, or maybe object hits the head. So whiplash, physical hits, those are, as long as they don't penetrate the skull, those are non-penetrating traumatic brain injuries. And even further, when we look into the traumatic brain injury umbrella, you have different severities, and this could include mild, moderate, and severe. So when we think about that, again, depending on the injury, there may be different criteria, but what we're looking for is trying to think, okay, is this mild? For example, in a previous episode, we talked about severity car accidents. You're going to have a more mild injury the slower you're going. So if you're hitting something at 25 miles an hour, that's going to be a whole lot less severe than two head-on collisions going 65. So that might determine uh, what it gets classified. Is it mild? Is it moderate? Is it severe? Depending on a lot of different factors. So things to think about because you know, obviously when you think of a car accident, you might think, okay, fender bender, you might think T-bone, you might think huge crash on I-95, but you got to really hash out those details, especially if you're in EMS in the medical field. Those details matter, and they will matter later on down the road for treatment, case managers, etc., etc. And even with traumatic brain injuries, generally speaking, as well as other injuries such as acquired brain injuries, you'll find that those can even be categorized into another two sets, such as focal, or very localized, or very specific areas, or you may have what's called diffuse injuries, which a diffuse injury is widespread or across a wide area of the brain. So, an example of a focal injury would be a gunshot wound. For example, if there is a specific stroke area, so if the stroke affects this area of the brain, just this area right here, small area, that's a very focal area to have a brain injury. Now, if you were to, like, let's say, get carbon monoxide poisoning, the lack of oxygen going to the brain would affect the whole brain, not just the outer structures, also the inner structures. And so these inner structures, just like the outer structures, do require that oxygen supply. Now, if you do talk about the traumatic brain injury, that could be classified as both focal or diffuse depending on the mechanism of injury. So those kind of details do matter. And they especially matter when later on down the line, you're going to have a case manager probably trying to advocate for you. And accuracy matters in healthcare, especially when acronyms can get confusing sometimes. So if I were to say, um, you know, work with someone who has mild traumatic brain injury, well, what if it was, should have been classified as something else, like a moderate or severe, depending on what was happening? Now, documentation does matter. So think about that when you're going through this. So let's do a little bit of a review. So, acquired brain injuries, traumatic, non-traumatic, or acquired, and they do not encompass congenital or birth problems or degeneration. Non-traumatic. Non-traumatic implies that there was no traumatic force, but still an injury or an insult to the brain, and this could go down to a lot of different areas. What do you think could be some? Well, a stroke would definitely make sense. A tumor, cancer, infection. Infection is another big one. Just to throw one out there, triple E or Eastern equine encephalitis. If it has encephalitis in the name, chances are with the swelling inside the brain, inside those inside the skull, chances are there's going to be injury there. And then you also have traumatic brain injury. You have moderate, mild, severe traumatic brain injury. You have penetrating and non-penetrating traumatic brain injury. And so those are the things to think about. when you think about what classifies a brain injury, you can go down that rabbit hole for a long time. Some agencies might have slight variations in their definition of brain injury, acquired brain injury, traumatic brain injury, but the concepts are still the same. So let's play a little bit of a game. We'll just say, okay, is this focal or diffuse? Is a fall focal or diffuse? It can be both. Can a gunshot wound be focal or diffuse? Technically, it can be both, depending on what areas it affects. Can a concussion be focal or diffuse? It might be both, depending on the mechanism of injury. Like, a blast wave or, falls, they can be focal or diffuse. Is it penetrating or non-penetrating? So, penetrating, it probably depending on the mechanism of injury. There could be a number of different things. And so, moving forward, we want to keep in mind that not only is this just a brain injury, this is also, is it a traumatic brain injury? Is it an acquired or non-traumatic brain injury? Is this mild, moderate, severe? Is this focalized in a certain area? Is this like specifically in this one area? Or is this generalized, like diffuse? And so we can go into those when we examine the future brain injuries. And again, these things vary depending on the mechanism that causes these brain injuries. Anyways, I do highly recommend that you look up the sources. Feel free to leave a comment, like, subscribe, whatever floats your boat. So hopefully you will have a wonderful day, and when this video comes out, we'll be in the middle of a holiday season, so please be safe out there. Anyways, take care, everybody.